had lost faith in these guys, but Usiro really showed. That's it, just looking at what problems exist and how can you be a part of.
At the moment, it's detrimental, you know. Populations such as the trans community, the gender non-conforming, who are accessing ARV treatments, your testing, your PrEP, your post-exposure prophylaxis. There are so many of these platforms that continue to be the citadels of sexual reproductive health care provision and support that now have suddenly been closed, and at least for a 90-day window, and we're still yet to know what the way forward is.
Really, I'm so impressed with him. I'm even prepared Monday to start working again with
the funding has been halted and the clinics have been closed. Someone now having disclosed, having come out in that particular clinic and is familiar with that environment, having to now go to a new environment, having to be tested again, having to feel, you know, essentially exposed, you know, going to a new environment with other people seeing them regularly, going to a clinic to collect medication, to go get tested, to go get regular administration of whatever form of healthcare when it comes to sexual reproductive health. It's taboo. There's a lot of stigma around it. It's something that brings about a lot of anxiety for people as well. They've gone into the crevices of our societies and created spaces where people no longer have to travel for 2 hours or sleep over at a friend's place and travel to the next town just to get their HRT. It's now something that's far more accessible because there are clinics now in virtually every town in South Africa where people can get access to HRT based on, you know, their support from aid, which is currently halted. So we've gone back to regional, essentially.
There was power in education in that way, and so I think these spaces allowed me to.
So our government has the mechanisms to support people as diverse as they are. The only difficulty is maybe the staff members might not have the capacity in the general, you know, healthcare facilities, the local clinics and hospitals, might not have the nuanced knowledge on what does it mean to be trans, what does it mean to be LGBTQIA+, and how to treat those people in amicable ways, ways that empower them and allow them to access healthcare in dignified and in ways that you know, allow them to not feel discriminated against in those spaces. And so that's the only hurdle there would be. Otherwise, generally, a person can, obviously, even in group form, come as cohorts to their local clinics and register, get tested there, and open files in their local clinics and continue to receive their treatment there. The only issue, of course, is the issue of capacity.
You're designing the hospitals. I mean, I've designed so many hospitals and clinics in my lifetime, I'm sad.